Welcome to our channel. This video is for educational purposes only. The information presented is in no way intended to diagnose or prescribe. If you have specific health concern, please contact your healthcare professional. Hello. Hope everything is well. In this video, we'll talk about stroke and how to identify it, so sit back and watch until the end of this video. What is a stroke? A stroke is a sudden interruption in the blood supply of the brain. Ischemic strokes are caused by an abrupt blockage of arteries leading to the brain. Hemorrhagic strokes are caused by bleeding into brain tissue when a blood vessel bursts. Because stroke occurs rapidly and requires immediate treatment, stroke is also called a brain attack. When the symptoms of a stroke last only a short time, which is less than an hour, this is called a transient ischemic attack (TIA) or mini-stroke. The effects of a stroke depend on which part of the brain is injured, and how severely it is injured. Strokes may cause sudden weakness, loss of sensation or difficulty with speaking, seeing or walking. Since different parts of the brain control different areas and functions, it is usually the area immediately surrounding the stroke that is affected. Sometimes people with stroke have a headache, but stroke can also be completely painless. It is very important to recognize the warning signs of a stroke and to get immediate medical attention if they occur. What are the types of stroke? As mentioned earlier, there is ischemic stroke. This occurs when an artery to the brain is blocked. The brain depends on its arteries to bring fresh blood from the heart and lungs. The blood carries oxygen and nutrients to the brain and takes away carbon dioxide and cellular waste. If an artery is blocked, the brain cells, or neurons, cannot make enough energy and will eventually stop working. If the artery remains blocked for more than a few minutes, the brain cells may die. This is why immediate medical treatment is critical. What causes it? It can be caused by several different kinds of diseases. The most common problem is narrowing of the arteries in the neck or head. This is most often caused by atherosclerosis or gradual cholesterol deposition. If the arteries become too narrow, blood cells may collect and form blood clots. These blood clots can block the artery where they are formed, like in thrombosis, or can dislodge and become trapped in arteries closer to the brain, like in an embolism. Another cause of stroke is blood clots in the heart, which can occur as a result of irregular heartbeat, for example an atrial fibrillation, heart attack, or abnormalities of the heart valves. While these are the most common causes of ischemic stroke, there are many other possible causes. Examples include use of street drugs, traumatic injury to the blood vessels of the neck, or disorders of blood clotting. There are also types of ischemic stroke which can be identified as thrombotic and embolic. A thrombotic stroke occurs when diseased or damaged cerebral arteries become blocked by the formation of a blood clot within the brain. Clinically referred to as cerebral thrombosis or cerebral infarction, this type of event is responsible for almost 50% of all strokes. Cerebral thrombosis can also be divided into an additional two categories that correlate to the location of the blockage within the brain: large vessel thrombosis and small vessel thrombosis. Large vessel thrombosis is the term used when the blockage is in one of the brain's larger blood-supplying arteries, such as the carotid or middle cerebral, as the name suggests. While small vessel thrombosis, yes, you guessed it right, involves one or more of the brain's smaller, yet deeper, penetrating arteries. Also called a lacunar stroke. The other type of ischemic stroke, the embolic, is also caused by a clot within an artery, but in this case the clot or emboli forms somewhere other than in the brain itself. Often from the heart, these emboli will travel in the bloodstream until they become lodged and cannot travel any farther. This naturally restricts the flow of blood to the brain and results in near immediate physical and neurological deficits. Who gets it? Ischemic stroke is by far the most common kind of stroke, accounting for about 88% of all strokes. Stroke can affect people of all ages, including children. Many people with ischemic strokes are older, about 60 or more years old, and the risk of stroke increases with age. Each year, about 55,000 more women than men have a stroke, and it is more common among African Americans than members of other ethnic groups. Many people with stroke have other problems or conditions which put them at higher risk for stroke, such as high blood pressure or hypertension, heart disease, smoking, or diabetes. So, how to reduce your risk? If you have ever had a stroke or experience any of the warning signs of a stroke, it is very important that you work with your doctor to determine the most likely cause of the problem and the best course of treatment for you. Certain medical conditions greatly increase your likelihood of having a stroke. Working with your doctor, you may need to begin specific medical treatment to control these risk factors, which would include previous stroke or mini-stroke, or a transient ischemic attack TIA. Depending on the most likely cause of your stroke, your doctor may prescribe specific medication or consider surgery to remove fatty deposits in your carotid artery. High blood pressure or hypertension is one of the leading risks for heart disease and stroke. Your physician may definitely advise dietary or lifestyle changes or specific medications to lower your blood pressure. Diabetes or high blood sugar can increase your risk, so you should work closely with your doctor to manage it. And there's heart disease. If you have an irregular heartbeat or atrial fibrillation, disease of the heart valves, congestive heart failure, or have had a recent heart attack, your physician may prescribe medications to thin your blood and/or reduce your cholesterol level. Good news is there are controllable risk factors and lifestyle choices that you can control, as the name suggests. Smoking, including second-hand smoke. Obesity, elevated cholesterol and elevated lipids. Physical inactivity. Excessive alcohol intake. And illegal drug use. Not so good news is there are uncontrollable risk factors as well. Increasing age. Male sex. Heredity and ethnicity. The second type of stroke is intracerebral hemorrhage. This occurs when a diseased blood vessel within the brain bursts, allowing blood to leak inside the brain. The sudden increase in pressure within the brain can cause damage to the brain cells surrounding the blood. If the amount of blood increases rapidly, the sudden buildup in pressure can lead to unconsciousness or death. Intracerebral hemorrhage usually occurs in selected parts of the brain, including the basal ganglia, cerebellum, brain stem, or cortex. What causes it? The most common cause of intracerebral hemorrhage is high blood pressure or hypertension. Since high blood pressure by itself often causes no symptoms, many people with intracranial hemorrhage are not aware that they have high blood pressure or that it needs to be treated. Less common causes of intracerebral hemorrhage include trauma, infections, tumors, blood clotting deficiencies, and abnormalities in blood vessels such as arteriovenous malformations. Who gets it? Intracerebral hemorrhage occurs at all ages. The average age is lower than for ischemic stroke. Less common than ischemic strokes, hemorrhagic strokes make up about 12% of all strokes. The third type of stroke is the subarachnoid hemorrhage. This occurs when a blood vessel just outside the brain ruptures. The area of the skull surrounding the brain, the subarachnoid space, rapidly fills with blood. A patient with subarachnoid hemorrhage may have a sudden, intense headache, neck pain, and nausea or vomiting. Sometimes this is described as the worst headache of one's life. The sudden buildup of pressure outside the brain may also cause rapid loss of consciousness or death. What causes it? It is most often caused by abnormalities of the arteries at the base of the brain, called cerebral aneurysms. These are small areas of rounded or irregular swellings in the arteries. Where the swelling is most severe, the blood vessel wall becomes weak and prone to rupture. Who gets it? The cause of cerebral aneurysms is not entirely known. They may develop from birth or in childhood and grow very slowly. Some people have multiple aneurysms. Subarachnoid hemorrhage can occur at any age, including in teenagers and young adults, and is slightly more common in women than men. There are several life-saving ways on how to get stroke diagnosed and treated. You may ask your medical professional advice on how to go about this. Always take the precaution of having a periodical medical checkup instead of going to the emergency room of the hospital because there is a need of serious medical attention already. Prevention is always better than cure. That ends our video for this time. Watch our other videos about general health and overall wellness. Please like, follow, subscribe, and click the notification button on our channel for our other videos. Stay safe and see you again soon.